Dr. Douglas Robinson, Camel Podiatry. We're going to talk about an ingrown toenail that's affecting the fourth toe. So anytime a nail is wider than the bed, it will spill over and can cause callus or thickening of what we call the ungulabia. So if you can see here, see there's a little bit of callus here. This side here, which is on toe number 4, and we number toes. The big toe is always number 1. The little toe that went to market is number 5. So this is the fourth toe, and this is the medial margin or the inside margin of this toe. So this is what's uncomfortable for this patient. So we're going to fix this nail, and I'll get him numbed up, and then we'll talk about specifically how this is going. You'll be able to visualize this, and I'll just walk you through the whole process of how to take care of an ingrown nail. This is on the fourth toe. So this toe's been anesthetized. I've just put a little rubber band across here. It's actually called a tourniquet so that it's not actively bleeding. We need a bloodless field to do this. I'm now just going to reflect the skin away from the nail here. There's no cutting of the skin. There's no sutures required for this. And what's really neat is when you see the nail edge cutting or buried in here, this is where I want to take enough nail so it doesn't cause this to reoccur. So now I'll just cut this straight back. All the way back in. And I can just lift it right out. And now you can see how much of the nail, that was that black line right against the ungulabia, the nail fold. That's how much was embedded there, and that's roughly a little less than 1/8 of an inch. So now there's a nice space here between the skin and the nail. Now I'm going to prep this so that it's ready to have a chemical applied to prevent this from growing back in. And we're going to protect the skin with this ointment. And again, we want a bloodless field, so we don't want any blood in there. That right there, I'm just going to wipe out again. The main purpose of getting this really dry is so that the chemical I apply can really focally cauterize that edge of the nail root, which is called the matrix. And this is called a partial, meaning not the whole nail, just a partial portion of the nail. It's called a partial matricectomy. And this chemical I'm using is called phenol. It's also known as carbolic acid. And that's how we're going to cauterize the root and prevent it from growing back in. Pain-free, permanent correction. When I say permanent, anytime you have surgery, there's a small risk that it comes back or it doesn't look good. Patient's not satisfied. I'm not satisfied. It has to be redone. And I'd say overall the success rate with this is over 85%. And now we'll just flush this. And the little extra skin here that was secondary to having that nail irritate, we're just going to trim that back. And I'll cut this back so he doesn't have to trim his nail for quite some time. Be totally comfortable. So now this is all taken care of. We're going to put a dressing on. And I'll have my patients start their soaks tonight. They're going to do Epsom salt soaks above the ankle for 10 minutes. And then they'll apply an antibiotic ointment with the Band-Aid. And that should be done every day. And if you bathe every day, you want to do this formal soak on the opposite time of the day, so 12 hours later. And if you do a bath or shower once a day, you can just change the dressing after you're done with that. And the key when you're doing a procedure like this on a lesser toe as far as applying a Band-Aid is the Band-Aids that we use are 1.5 by 3 inches. For a lesser toe, to get it to stick on good, I recommend cutting it in half and just taking that Band-Aid and wrapping it around the toe. And that's all you have to do. And by doing this procedure, you'll end up with our goal, which is this, which is a very, very happy, happy patient and a happy, happy toe. I'm Dr. Douglas Robinson. This is how we take care of a lesser toe ingrown toenail. Please take care of yourself and each other.